morning. Is it truly possible to move teeth as an adult and correct existing dental asymmetries without resorting to surgical intervention? Well, it is important to note that teeth can indeed be moved at any age, as long as there are no active gum inflammations or significant dental infections, such as, for example, cavities. And you can correct mild to moderate asymmetries without resorting to surgery, but by aligning them with clear aligners, transparent trainers. Obviously, major skeletal asymmetries in adults, on the other hand, need to be corrected through surgery. And let's look at the case of Roberto, who came to us because why? Because when Soridel spoke, he had this crowding with overlapping teeth both on the top and bottom. Before aligning the overlapping teeth for aesthetic reasons, we conduct a case study. So as you can see from the photos, it's not just that the teeth are twisted, but there are also asymmetries in the anterior occlusal plane. In other words, the teeth on one side are lower than on the other, so they're lower even when looking at the lateral smile. We can see that the upper incisors are tilted far back. You can notice this a bit from this photo with the smile. The upper teeth are aligned too far back, so we need to bring them forward and align them, not just for aesthetics, but to place them in the correct position. In the photo, however, with the mouth open and closed, you can see that the midlines, the upper and lower interincisal lines, do not match up, either when the mouth is open or closed. They are always shifted, the upper one to one side and the lower one to the other. Furthermore, when the mouth is closed, as you can see in the lower left, the upper teeth all close in front of the lower ones. The red lines should align and then become green on the side, but instead they do so only in the back, on the right side. Chewing. The bite is correct, but we have a very deep bite, what is called an increased overbite. The lower incisors are very hidden by the upper ones, so they face this large anterior wall and struggle every time to get past it. Every time we speak, chew and swallow. In the photo of the palate, you can see how the teeth on one side, the left side, are all further forward compared to those on the right. As a result, the final outcome is that the front teeth are shifted to the patient's right side. On the lower level, however, the lower teeth are still centered, but they are all crowded because they are inside the upper arch, which is also crowded. The upper arch is narrow. This is the photo of the palate. The palate, the bone itself, is symmetrical, but the teeth, the arch, and all the bones surrounding the arch are not. They are all shifted to the side. We need to make the arch symmetrical within the palate, so first we will work on the posterior sections, not the front ones. Those will be made symmetrical and straightened, and then afterwards we will move the teeth. The upper front teeth will be centered and aligned in the correct position. To do this, we need space at the back on one side, on the left side. On the left side, to move the teeth backward, we need space that we have to create by removing the upper left wisdom tooth. And you can see that the teeth have room to move back. Whereas on the right side, we will not remove it. So before starting, we always need to take a panoramic X-ray to clearly see the axis of the teeth and to get a good look at the wisdom teeth. And then the other X-ray, the cephalometric X-ray, which is a skull X-ray from which we will make all these measurements to clearly understand by how many degrees we can move. And tenths of a millimeter to move the teeth within the bone basis, because we have limits, ranges to respect. And this is a bit of a simulation of the digital setup. We decided to move the teeth with transparent aligners, both on the upper arch and on the upper arch. And these are the movements. You can see how the teeth move with some shifting backward on one side and the upper ones moving forward to align. So what do you see in red? These little red beads in the mouth are actually transparent and are used to help the aligner fit correctly onto the tooth. Side view of the programming and setup of the movements. You can see how the teeth are moved to make them fit together correctly. Especially on the side where we will be working the most, the left side. And these are the first 6 months. To work on the back sections, we place metal bars on the posterior sectors. There are also transparent ones, but they are a bit more fragile, and these are used in combination with aligners on the lower and upper front arches. And elastics were used for 6 months. You can see how after 6 months, the teeth fit together correctly. In the back, we achieved the correct bite on the left side especially, and we maintained the correct bite on the right as well, even after 6 months. You can see on the lower teeth how we have already corrected the deep bite, which has already improved, and we have properly aligned the teeth. This is a bit of a simulation of the movements needed to achieve this correct bite. After 6 months, these metal bars are removed, and the next phase will be a full set of aligners, both for the lower and upper arches, still using elastics to ensure the teeth fit together properly. This is a photo of the palate. First, we address the causes, which are in the posterior sections. You can see how we have made the back teeth fit together well and made them symmetrical. These spaces have been created, which we will now close in the second phase. The second phase will only involve clear aligners and elastics to move the upper teeth back and close them into the correct position. You can clearly see that after a substantial total of 20 months, which means after an additional full year, we have successfully managed to make the left teeth fit together properly and precisely, as well as the right ones, and the dental midlines have become perfectly centered and aligned between each other, and also the deep bite. We have corrected it very well, so the patient's front teeth now touch properly and comfortably. They no longer have that very strong, uncomfortable contact that was present before. You can see the before and after of the teeth, how they move back, how the midlines fit together well before and after. How do they become centered again? And the lower teeth, how well they appear, how well aligned they are. The opening, again, the symmetry, the occlusal plane, from how it was crooked like this. We have recentered both the upper and lower teeth, so we have also made the occlusal plane symmetrical, but above all the palate. See how uneven it was, and now how the lines match up. See how we have made the right teeth symmetrical with the left ones, which was our goal. Final smile, straight teeth. The teeth, even from the inside side view, make good contact. And that's also the patient's goal, to have good aesthetics and proper chewing. If you have any questions, write them in the comments below and give us a like. Thank you, and I wish you a good day.